Greetings. My name is Dr. Sesen Negash. I am a faculty member at San Diego State University, and I'll be briefly discussing today an article that I've published along with two of my MFT colleagues in Family Process. The article is entitled Families Post-Release, Barriers and Pathways to Family Therapy. Of those released from incarceration, the vast majority intend to reunify with their families. However, family stabilization post-release is complex and arduous. Despite not being empirically studied, the use of therapy for families post-release is generally supported. For family therapy to succeed, however, therapists must understand the rich and complex context of families they serve. Well-intentioned, skilled therapists may be unsuccessful if they fail to understand the unique and cumulative stresses associated with post-release for families. While not exhaustive, this article highlights potential attitudinal, relational, and logistical barriers to family therapy engendered by therapists, clients, or both. It also highlights pathways to mitigate said obstacles to therapy for both clients and therapists. To start, we discuss some of the attitudinal barriers, including stigma. Among the most commonly stigmatized people are those involved with the carceral system and those seeking psychotherapy. When considered together, some family members may be less inclined to participate in any form of therapy, including family therapy. Concern about therapist cultural competency and responsiveness is also examined in this article. Few family therapist trainees receive education and/or training opportunities with families in incarceration and reentry. Not surprisingly, therapists who fail to demonstrate an understanding of the hardships associated with the carceral system tend to be distrusted by clients post-release. To reduce the knowledge and training gap, therapists are encouraged to grow their competency through professional development focused on understanding the carceral system, the inequities within that system, the intra and interpersonal implications of incarceration, and the cumulative stressors associated with post-incarceration. All that said, families post-release should not be treated as a monolith. We also look at community engagement. Many therapists are far removed from the everyday lived experience of individuals and families involved with the carceral system. Therapists' knowledge about the carceral system and its systemic impact is often limited to what they read in the literature. With that in mind, therapists are encouraged to increase their social awareness and responsibility by actively engaging community members directly affected by the carceral system and establishing rapport with service providers working with folks post-release. Power and privilege must also be considered, especially in terms of retention. The combination of prejudice, oppression, and the abuse of institutional and individual power within the carceral system is mainly perpetuated against racially, ethnically, and economically minoritized individuals. This calls on therapists to be vigilant about their use of power in therapy, particularly when working with minoritized families. Concerns about confidentiality should also not be overlooked. It is reasonable to expect that individuals released from incarceration, particularly those on parole, may perceive therapists to be extensions of the carceral system. Concerns about therapists' roles and how to manage confidentiality might discourage families from participating in therapy and should be addressed. We also look at relational barriers and pathways, including physical distance. A sizable number of individuals do not reside with or near their families after being released from prison. In part, that may be due to travel restrictions, curfews set by probation, or transitional living facilities or inpatient facilities. As a result, the physical distance between family members may reduce any accessibility and utility of family therapies. To help mitigate that physical distance, therapists should consider the use of telemental health. Then you have logistical barriers and pathways. Individuals released from incarceration often face fewer opportunities for education and employment and are employed at lower wages. Financial hardships can make it more difficult for families post-release to receive services. Therapists who decline to accept insurance but who are still interested in serving families post-release may consider offering some of their services pro bono or on a sliding scale. However, offering free or low-cost therapy is meaningless to families unless the families are aware that these services exist. We suggest family therapists promote their services through community reentry organizations or organizations that have a sizable number of clients that identify as being part of the reentry community. Community organizations in particular serve as an important resource for this population, especially in their efforts to gain secure healthcare. For more information about the recommendations and ideas in the study, we encourage you to look up our article on family process. Thank you so much.